Virginia hospitals face $26 billion loss from Medicaid cuts. Imagine the shockwaves that could ripple through Virginia's healthcare system if federal Medicaid cuts go into effect. Virginia hospitals are bracing for a staggering $26 billion loss over the next 14 years, according to new state estimates. This financial earthquake is set off by changes in President Donald Trump's tax and spending law, a piece of legislation once affectionately dubbed the One Big Beautiful Bill, and signed into law on July 4th. But here's where it gets controversial. The law is expected to slash federal funding for Medicaid, the government-backed program that provides health care coverage for eligible low-income adults, families, children, pregnant people, and people with disabilities. The nonpartisan Congressional Budget Office estimates that by 2034, this could result in 10 million fewer people with health insurance. And this is the part most people miss. The law also introduces new requirements for Medicaid members and restrictions on taxes levied on hospitals. In Medicaid expansion states like Virginia, the law mandates that Medicaid managed care organizations reduce payments to healthcare providers by 10% each year starting in 2028 until it reaches 100% of the Medicare rate. This change is estimated to cause a $26 billion reduction over 14 years because MCOs in Virginia pay providers well above the Medicare rate. According to Chris Gordon, the chief financial officer of Virginia's Department of Medical Assistance Services. Gordon warned lawmakers that such a loss in funding would have significant ramifications for the state's economy. The cuts will create a macroeconomic financial shock, not just to the hospitals, but also for the state writ large. Gordon told the General Assembly's Joint Subcommittee for Health and Human Resources Oversight in a presentation on July 15th. Gordon added, "There will be a reduction in labor force participation because the quickest thing to do is reduce head counts when you're faced with something like that, as well as population as people move to try and migrate out to do jobs elsewhere." A spokesperson for Governor Glenn Youngkin called Gordon's remarks into question, writing in a statement last week that the comments were not based on an official DMAS analysis. Any economic impacts should be evaluated by individuals with specific expertise in hospital finance. Youngkin spokesperson Peter Finocchio added. Scott Elmquist /VPM News file DMAS provided a similarly worded statement Tuesday. These speculative comments were not based on official DMAS analysis. Any economic impacts should be evaluated by individuals with specific expertise in hospital finance and economics. The department did not respond to questions on who in Youngkin's administration approved the presentation and if the department stands by the estimates. It also did not provide the modeling Gordon referenced. Finocchio did not respond to follow-up questions on if Youngkin has been briefed on the DMAS estimate and whether the governor has concerns over the potential reduction in reports showing Virginians will lose their coverage. Instead, he touted new requirements that able-bodied Medicaid recipients engage in 80 hours a month of work, community service, education, or a combination thereof. Medicaid was originally formed as a safety net for people who otherwise couldn't go to work, but today there are an estimated 40,000 to 50,000 able-bodied people currently not going to work who should, Finocchio said in a Monday statement. The Medicaid reforms in the One Big Beautiful Bill will provide accountability for those abusing the system while ensuring that individuals who are truly disabled, have dependents, or elderly still have access to the benefits they rely on. That's something the vast majority of Americans and Virginians fully support. Finocchio cited a 2018 state study from the nonpartisan Joint Legislative Audit and Review Commission that estimated 7% of the Medicaid expansion population would be deterred from enrolling or leave the Medicaid program due to proposed work requirements when Virginia expanded coverage to eligible low-income adults. An Urban Institute study from June found 69% of Medicaid expansion enrollees do work or go to school, with only 2% reporting a lack of interest in a job as their reason for not working. Critics of such requirements have pointed to estimates and reports finding they don't lead to an increase in employment, arguing they instead create barriers that will increase the number of uninsured people. Gordon, who as DMAS CFO has overseen Virginia Medicaid's financial operations since February 2019, and other state officials outlined the potential effects of the new law to the subcommittee. The new law calls for phased-in reductions to the provider taxes that cover Virginia's share of Medicaid expansion costs and draws down federal dollars for Medicaid supplemental payments. For Virginia's Medicaid expansion population, the federal government covers 90% of the annual costs. The state pays the rest through a 6% coverage assessment tax it levies on patient revenue at 63 private acute care hospitals. The new federal law requires Virginia to lower that tax by 0.5 percentage point each year, starting in October 2027, until it hits 3.5% in 2032. That timeline is based on federal fiscal years, which run from October 1st to September 30th. Virginia's fiscal year runs from July 1st to June 30th. The private provider tax generates $1 billion a year that the state combines with federal dollars to make supplemental Medicaid payments to hospitals in an attempt to close the reimbursement gap. Medicaid agencies already pay providers less than the cost of the services they provide. With the law capping state-directed payments at the Medicare reimbursement rate, private acute care hospitals in Virginia are estimated to see a $24.8 billion funding reduction over 14 years, and the VCU Health System and UVA Medical Center will lose out on $1.2 billion, according to the DMAS presentation. Analysts and health system leaders have warned of the possible ripple effects of the law's impact on Medicaid, including potential hospital closures, healthcare service reductions, and job losses. Democrats on the subcommittee raised concerns about hospitals and healthcare facilities being able to operate and the risk of closures without the funding. State Senator Adam Ebbin, D. Alexandria, asked Gordon to clarify whether it was a federal government directive or if the state was getting less federal money. The federal government is directing us to tax the hospitals less and to reduce the amount we're paying them above Medicare. So it's both, Gordon said. So, in spite of inflation or medical inflation, they expect these private acute hospitals to provide the same level of care with $26 billion less, while costs would go up normally. Evan asked. Yes, Gordon responded. Shabana Thillman/VPM News Julian Walker, Vice President of Communications with the Virginia Hospital and Healthcare Association, said VHHA estimates show the law's Medicaid provisions will cost Virginia hospitals $2 billion a year. State-directed payments account for 16% of net revenue for hospitals, Walker told VPM News, and it's more than 20% for some that serve higher shares of Medicaid patients. It is difficult to imagine a scenario in which any organization, whether hospital or something outside of healthcare, because of a policy decision, eventually loses 15, 20, 25, 30% of revenue, and that organization continues to function and exist in the same fashion it did prior to absorbing that very significant financial hit. One major focus has been the potential impact on rural hospitals, which already face financial struggles and are at risk of joining others that have shut down. If the funding cuts happen, Walker said they will make an already very challenging situation for rural facilities worse. He noted that rural hospitals serve a higher share of patients covered by Medicaid and Medicare and struggle with recruiting and retaining staff. A June analysis by the Center for Healthcare Quality and Payment Reform found 7 rural hospitals in Virginia are at immediate risk of closing, including Southern Virginia Regional Medical Center in Emporia and VCU Health Community Memorial Hospital in South Hill. In a June 12th letter, U.S. Senate Minority Leader Chuck Schumer, Democrat New York, and other Democrats raised concerns on the bill's impact on rural hospitals to Trump and Republican congressional leaders. The letter states that 6 rural hospitals in Virginia are at risk of closing, citing information provided by the Cecil G. Shep Center for Health Services Research at the University of North Carolina. Since at least last week, web pages for the North Carolina Rural Health Research Program at the Shep Center, which gets federal funding, have been under review. Some information is still offline. The Shep Center did not respond to messages seeking comment. The law includes a Rural Health Transformation Program grant that will offer $100 million in funding that Virginia can apply for, with additional future competitive grants for states. The $50 billion fund is roughly a third of the estimated federal Medicaid funding loss in rural areas, per the Kaiser Family Foundation. Before Trump signed the bill July 4th, State Democrats raised concerns over congressional reports estimating that nearly 323,000 Oregon caregivers fear looming Medicaid cuts. What you need to know. Imagine being a caregiver, dedicating your life to supporting a loved one, and suddenly facing the devastating reality that the funding you rely on to provide that care might be ripped away. This is the harsh truth that many Oregon caregivers, like Andrea Carr, are grappling with as they await the looming federal budget cuts to Medicaid. For Carr, a personal support worker who cares for a 33-year-old daughter with a disability, the prospect of losing Medicaid funding is nothing short of catastrophic. "We could be destitute in 2 months. We would be out in the street," she says, her voice laced with worry and fear. The recent policy bill signed into law by President Donald Trump has sparked widespread concern among caregivers, who are unsure of how the changes to Medicaid will affect their livelihoods and the well-being of their loved ones. But here's where it gets controversial. The Trump administration claims that the bill will actually strengthen Medicaid, not cut it. However, disability advocates and caregivers are skeptical, and their concerns are rooted in the potential consequences of the cuts. Oregon, in particular, is expected to be heavily impacted, with over 20% of its Medicaid enrollees at risk of losing their coverage. The state's reliance on provider taxes, which are levied on healthcare providers like hospitals, makes it especially vulnerable to the changes. These taxes are a crucial revenue source for Oregon's Medicaid program, and the state may be forced to reduce them under the new federal law. This could have a ripple effect, impacting not only caregivers but also the individuals they support. As Jake Cornett, Executive Director and CEO at Disability Rights Oregon, notes, "We're all bracing for the impact of Medicaid cuts. We don't know exactly how they will impact Oregon, but we do know it's going to be bad for people with disabilities." The uncertainty surrounding the Medicaid cuts has created a sense of turmoil among caregivers, who are already struggling to make ends meet. Many are speaking out, like Sean Notdurft, a 57-year-old caregiver who has spent over 3 decades in the field. He believes that a workforce standard board, which would bring together caregivers, employers, and state officials to discuss challenges and solutions, is essential for creating positive change. However, not everyone agrees. Lois Gibson, Executive Director of the Oregon Resource Association, opposes the idea, citing concerns about bureaucracy and the potential duplication of efforts. As the debate continues, one thing is clear. The fate of Oregon's caregivers and the individuals they support hangs in the balance. And this is the part most people miss, the human impact of these policy decisions. As Carr so eloquently puts it, "It's totally turned my life and every other personal support worker in Oregon upside down." So, we must ask, what do you think is the best way to support caregivers and ensure that they can continue to provide high-quality care to those who need it most? Should the focus be on increasing wages, creating a workforce standard board, or exploring other solutions? Share your thoughts and join the conversation. The future of caregiving in Oregon depends on it. Virginia hospitals face billions in losses under new Medicaid rules. Virginia hospitals are staring down a financial abyss, with potential losses in the billions, as state Medicaid officials scramble for clarity amid sweeping federal healthcare reforms. Yet this isn't just about balance sheets. 600,000 vulnerable Virginians could lose coverage if they can't meet strict new requirements. And here's the critical blind spot. Federal guidance remains missing for 90% of the changes. Cheryl Roberts, Virginia's Medicaid director, laid bare the uncertainty to lawmakers. "When I say we don't know, we really don't know yet." The reforms primarily target those covered under Medicaid expansion through the Affordable Care Act, introducing 80 monthly hours of work, education, or community service. But here's where it gets controversial. Compliance checks just doubled, from once yearly to every 6 months, creating a bureaucratic maze. State Delegate Rodney Willett, DeHenrico, minced no words. Under the current system, you need a master's degree to understand the forms, even with help. The financial stakes are staggering. The Virginia Hospital and Healthcare Association projects $2 billion in annual losses, risking closures, especially in rural communities where hospitals anchor local economies. Roberts confirmed the scale. We give hospitals billions now. The decline? Also billions. Senator Chris Head, our Bodatort, described foreboding fear among hospital administrators, paralyzed by unanswered questions. Lawmakers remain in special session, but face frustration. Delegate CIA Price, The Newport News, highlighted the brutal truth. We have no true sense of what we're up against. Congress is gone for summer, and we're stuck protecting Virginians without transparency or specifics. So let's confront the elephant in the room. Are work requirements a fair exchange for health care, or do they penalize low-income families? And can Virginia afford to wait while rural hospitals crumble? Your perspective matters. Drop your take in the comments.